The knee is one of the most complex joints in the human body. It's a hinge joint, but it also rotates and glides. This allows for a wide range of motion, making activities like walking, running and jumping possible. The knee joint is formed where the thigh bone or femur meets the shin bone, known as the tibia. The kneecap or patella protects the front of the joint. Ligaments are strong bands of tissue that connect bones and provide stability. Cartilage cushions the bones and allows them to move smoothly against each other. The knee also has fluid-filled sacs called bursae, which reduce friction between the moving parts. The medial collateral ligament, or MCL, is a key player in knee stability. It's a thick band of tissue located on the inner side of your knee, connecting your femur to your tibia. The MCL's primary job is to resist inward bending forces on the knee. Imagine someone bumping into the outside of your knee while your foot is planted on the ground. The MCL helps prevent your knee from buckling inward. This ligament also plays a role in controlling the rotation of your knee. It works in concert with other ligaments to keep your knee joint aligned and functioning correctly. An MCL sprain occurs when the ligament is stretched or torn. This usually happens when a force pushes the knee inward, stressing the ligament beyond its normal range. MCL sprains are graded on a scale of 1 to 3, depending on the severity. Grade 1 is a mild stretch, Grade 2 is a partial tear, and Grade 3 is a complete tear. Symptoms of an MCL sprain can range from mild pain and swelling to severe pain, instability, and difficulty walking. The severity of your symptoms will depend on the grade of your sprain. MCL sprains are common sports injuries, particularly in activities that involve pivoting, cutting and contact. Sports like football, soccer, basketball and skiing put athletes at higher risk. However, you don't have to be an athlete to experience an MCL sprain. Everyday activities like slipping on a wet surface, missing a step, or even twisting your knee awkwardly can also cause this injury. Understanding the common causes of MCL sprains can help you be more aware of potential risks and take steps to protect your knees. Section 5. Prevention is key safeguarding your knees. While not all MCL sprains are preventable, there are steps you can take to significantly reduce your risk. This includes focusing on strength training, using proper techniques during physical activities, and considering protective gear. By incorporating these preventive measures into your routine, you can bolster your knee's stability, improve your body's control, and minimize the chances of experiencing this painful injury. Remember, a little prevention can go a long way in keeping your knees healthy and strong for years to come. Section 6. Strength training building your knee's defense force. Targeted strength training is crucial for building a strong and stable base for your knees. Strong leg muscles act as shock absorbers and help protect the ligaments from excessive stress. Focus on exercises that strengthen your quadriceps, hamstrings, glutes and hip abductors. Squats, lunges, hamstring curls and calf raises are excellent exercises to incorporate into your routine. Remember to start slowly and gradually increase the intensity and weight as you progress. Proper form is essential to maximize benefits and prevent other injuries. Section 7. Gear up for protection, knee braces and support. In certain situations, using protective gear like knee braces can provide additional support and stability to the knee joint. This is especially beneficial for athletes involved in high-risk sports. There are various types of knee braces available, each offering different levels of support. For MCL protection, a hinged brace that limits sideways movement can be helpful. Consult with a healthcare professional or athletic trainer to determine the most appropriate type of brace for your needs and activity level. Section 8. Post-injury care. Navigating the road to recovery. If you do experience an MCL sprain, prompt and appropriate care is essential for optimal healing. Immediately following the injury, follow the RICE protocol: rest, ice, compression and elevation. Avoid activities that put stress on the injured knee. Ice the area for 15 to 20 minutes at a time, several times a day, to reduce pain and swelling. Use a compression bandage to provide support and limit swelling. Keep your leg elevated as much as possible to minimize inflammation. Over-the-counter pain relievers can help manage pain and discomfort. Section 9. Physical therapy, your partner in healing. Depending on the severity of your MCL sprain, your doctor may recommend physical therapy as part of your recovery plan. Physical therapy plays a vital role in restoring strength, flexibility, and range of motion. A qualified physical therapist will design a personalized program tailored to your specific needs. This program may include exercises to strengthen the muscles surrounding the knee, improve balance and coordination, and restore full joint function. Following your physical therapist's guidance and adhering to your rehabilitation program diligently are crucial for a successful recovery and a safe return to your desired activity level.